Well, I am very delighted to welcome you and to see you here. The news is the weather, but we are very pleased that you made it and made it in safely, and we have a good turnout. Um, this workshop is being um, live on the web, so people will be joining this workshop via the internet, and we are very delighted to have that. I'm Maxine Hayes, and I am the State Health Officer for Washington State Department of Health, and had the privilege of chairing the committee that planned this workshop today. I'd like to acknowledge all members of the committee, and they will be participating throughout the day in various roles, primarily moderating a number of panels that we've organized. But I invite you to look at their bios in the little notebook that you were given. We had a very diverse set of perspectives in terms of thinking through this workshop. So we anticipate a very provocative conversation and over the course of these 2 days. I'd like to do a couple of things to start us off, and that is to refer to this infographic that is being projected. I'd like to also just tell you that we had intended to have these posters available to hand out today. We don't have them, but we will make sure that attendees who are interested will get a copy after this is done. Let me just review for everyone the purpose of the workshop so that we start this conversation with everyone being on the right page. Having done this before for the academies, I know that oftentimes we really want the workshop to answer some questions that we were not asked to consider. It's very easy to have a set of expectations that are not in alignment with what the assignment really is. So this is the beginning, hopefully, of a number of conversations. But what we were asked to do was this. We were to review and update the 1982 IOM National Research Council report on research issues in the assessment of birth settings. So that was the assignment. We haven't had an assessment since 1982, and that's been quite a while. And as you know, things around us are evolving and changing. We will have presentations in this workshop from invited speakers, and we will follow those presentations by discussions that will highlight research findings that really help advance our understanding of the effects of maternal care services in different types of institutional settings on maternal labor, clinical and other birth procedures, and birth outcomes. These settings include conventional hospital labor and delivery wards. They also include alternative birth settings that may be hospital affiliated or may be freestanding, and home births. So that's really the scope, the gamut of these different settings. And foremost, I'd like to start by thanking the W.K. Kellogg Foundation for their support. And I'd like now to introduce the program officer, Patrick Simpson, who is in charge of Kellogg's Food, Health, and Well-Being. Let me just tell you a little bit about Patrick, and I have had the pleasure of knowing him for a very long time. He is the program officer, as I said, at the Kellogg Foundation in Battle Creek, Michigan. And as a member of the Food, Health, and Well-Being team, he serves as a convener, a collaborator, and a catalyst responsible for nurturing opportunities for effecting positive systemic changes in communities and executing programming efforts align with the Foundation's mission. His focus is primarily on funding opportunities that enable the Foundation to make progress in ensuring that all children can grow and thrive by having love, good parenting, high-quality food, physical activity, interaction with nature, and access to health care. Prior to joining the Foundation in 2010, Patrick spent nearly 15 years with City Match in Omaha, Nebraska, an organization focusing on maternal and child health needs in U.S. urban areas. And it was in this role that I first met him. He has held positions in City Match, including Executive Director, the Director of Operations, Program and Policy Manager, Project Coordinator for Policy and Research. And since 2007, he has also been an instructor of child health policy at the University of Nebraska Medical Center, the Department of Pediatrics. Pat holds a bachelor's degree in biology from the University of Nebraska at Omaha and a master's in public health from the University of Alabama at Birmingham. Let us welcome Patrick Simpson, and he will start us off by providing a few words. Thank you so much, Patrick, for being here.
I always sound more impressive when people read things off of paper. So first I wanted to thank you all for weathering the storm. Like the weather, this topic that no matter what, babies are born, you can't stop it from happening. Just like the weather, you can't stop the storms. And I'm thrilled to see such a great group of passionate people in the audience. So like Maxine said, part of the Foundation's interest in this topic is to improve the health of women and children, to enhance the opportunity for vulnerable children to be born healthy in loving homes. And when I started at the Foundation a couple years ago, I was meeting with some grantees, and one of those grantees was at a freestanding birthing center. And we were having the discussion about, what really impacts a woman's birthing experience? How do you go through the process in a stress-free environment? Because we know from the science that reducing stress in women helps improve birth outcomes. And so how could the Foundation enhance that opportunity for women to have a choice, to seek out places that they felt comfortable, and that, was it safe? Was it, a good way to go down this path of freestanding birthing centers? And that's really how this question evolved, because we understand that there's a lot of passion in this area about where children should be born, whether it's safer in a hospital, should women have the opportunity to do it at home with a licensed nurse midwife, should they do them in freestanding birthing centers, what's the role of physician, nurse midwife, doula, et cetera. And so when we went to the research, we saw that it really hadn't been updated in about 30 years. And so it was a great opportunity for the Foundation to make a small investment in this meeting. And like the Institute of Medicine, we don't have a stake in the outcome. We're here to learn just like everyone else. We're not pushing one way or the other. We just want to better understand the science so that it can inform the grant making that we do as a foundation. When I joined a couple of years ago, my boss, Dr. Gail Christopher, said, just find things that the foundation can make a difference in. That there's a lot of things we know about the science around improving birth outcomes, but we still have horrible outcomes in this country. And so with the small investments that the foundation's able to make, go out, find ways that our money can make a difference, and report back. And so this is actually one of the first investments I made when I joined the foundation as a program officer. So I'm excited to hear the results, and wish you all luck. And it really was nice to see Maxine. As she said, we've had a long history, and she's really one of my heroes in the field. So thank you guys for having me.
Well, thank you so much, Patrick, and we're just really delighted to work with Kellogg. Kellogg has done so much in our communities, and we're just delighted. Joining us also for some formal welcoming remarks is my colleague and friend, Isadora Hare, who is with the Division of Healthy Start and Perinatal Services for the Maternal Child Health Bureau. And I really am so happy Isadora was here because, as you know, the federal government is closed today. So we expected to have a lot more of the HRSA people here, but many of them were not able to get out, and she was very determined to have HRSA represented. I've known Isadora for quite some time, and I'm just very happy that she's here with us. So if you would please come and say a few words from the Maternal Child Health Bureau. Thank you, Isadora.
So let me start off straight away and answer your unspoken question. I'm originally from South Africa, not from the UK, but from South Africa. And it is my great pleasure today to bring you greetings from the Maternal and Child Health Bureau within HRSA. As many of you may know, Dr. Michael Liu, an OBGYN from UCLA, has been the associate administrator of our bureau for just over a year now. And he is joined in sending his greetings by Dr. Hani Atrash, who is also new to the bureau. He's been there about 6 months. And he is the director of the division in which I work, which is the Division of Healthy Start and Perinatal Services. Both of them really regret that they were unable to participate more actively in the workshop, as they are most interested in this topic of research issues in the assessment of birth settings. At MCHB, of course, we have a strong investment in the health of mothers and babies and welcome any additional research that would provide a strong evidence base for factors such as birth settings that can contribute to the safety, quality of care, and good health of mothers and babies in the intrapartum period, as well as in the preconception period, during pregnancy and postpartum. You may know that Dr. Liu has been a strong proponent of the life course approach to maternal and child health, and we see this as one step along the way. We therefore anticipate with great interest the recommendations that will emerge and future research on this important topic. Since Dr. Liu's arrival in the Bureau, he has moved quickly to initiate several major projects, and I'm going to tell you briefly about 2 of these, seeing that they have great relevance, I think, to the settings and outcomes for the pairs of mothers and babies involved in the process of childbirth. The first pertains to infant mortality, and the second to maternal mortality and morbidity within the setting of a broader approach to women's health. This latter one is under the leadership of Dr. Atrash and also of SACM, the Secretary's Advisory Committee on Infant Mortality. So I'm sure in this audience you all are familiar with the infant mortality statistics in our country. I think the latest rate is 6.61 per 1,000 live births, although my colleagues from NCHS, I'm sure, will go into some of this in much greater detail. The very troubling thing is the disparity between the rates for African American women, non-Hispanic Black women, and non-Hispanic white women. And when you look at those separately, you see that the rate for African American women is more than double what it is for white women. And it places the United States 27th among industrialized nations for infant mortality. And interestingly, I think for the purposes of this workshop, a goodly proportion of these, the majority, occur in the neonatal period. So to address the concern of the country about these rates, Secretary Sebelius announced in June of last year that she was launching a national initiative to reduce infant mortality. And at the same time, there was a movement at the state level also to address this issue. They had a summit in New Orleans involving the 13 states in the southern part of the United States. And from that has emerged an initiative called COIN. This acronym stands for a Collaborative Innovation Network and has been defined as a cyber team of self-motivated people with a collective vision that innovatively collaborate by sharing ideas, information, and work enabled by technology. And in terms of this particular one, we added another word, which is improvement, so that it is a collaborative for the improvement and it's a collaborative involving an improvement and innovative network. So although this remains at the state level, excuse me, MCHB is working very closely with the states involved at this point to provide some management and leadership. The 5 priority strategies of COIN are